Welcome to How You Move, presented by HSS. We have an esteemed panel here today that we're going to be talking a little bit about injury prevention, local high school sports.
I'm Dr. Karen Sutton, and I'm an orthopedic surgeon in sports medicine at HSS. I'm also the head team physician for U.S. lacrosse.
And I'm Dr. Brad Waddell. I'm also an orthopedic surgeon at HSS, and I specialize in hip and knee reconstruction.
I'm Misa Maloney. I'm a junior at Darien High School. I play for the varsity girls lacrosse team, and we are currently number 2 in the nation.
And my name is Justin Clark, the Director of Outpatient Rehab here for HSS in Stanford. Mason, can you tell us a little bit about high school sports at Darien High School?
When I came to the high school as a freshman, I played both field hockey and lacrosse. All the teams around the high school do so many events to bond everyone and come together to become closer and just a bigger teammate, I guess you could say. And I guess that's what leads most of our teams to have so much success, is because we're all so close with one another.
And can you tell us a little bit about being, part of a team environment, team atmosphere, how that helps you in school and outside of school, and how that really benefits you in being part of such a big and elite high school program?
Darien High School is a very academic school to begin with, and then being able to take a break from that and go into the field with all your friends, it's a nice break. It kind of boosts your hopes, takes away some of your stress, allows you to bond with all your friends more, creates kind of a positive environment.
So tell us about before a game. How do you build yourself up to leave your backpack on the floor, and then you grab your stick, and then you're walking out of the field? Is there anything individually you do to psych yourself up?
Individually, well, in the locker room before every game, every lacrosse game, we listen to our pump up playlist, and everyone is dancing together. It's a really good environment. I think I just put my mind at a place that's a lot different than school. That will get me more ready for the game.
Preparing yourself for the game or for practice, do you guys have a stretching routine or a warm-up routine so that when you do get into the game, you're at your full capacity with the least chance of an injury?
Yeah. So what we do, depending on how many captains we have each year, this year we have 4 captains, so each of the captains will line up and everyone will make a line behind them, and we kind of just do dynamic stretching, and we just follow them whatever they're doing in a straight line, just so it looks very coordinated. And then after stretching, we split up offense and defense. The defense works on their footwork and their stick skills, while we work on our stick skills as well. And then the people who take the draw will kind of separate themselves as well, do a couple self draws, and then we all come together for setup, and we'll be running the plays that we will be doing for that game.
So that's great to hear that there's an organized way to prepare for the game, because far too often as surgeons we see patients who come in having not been properly stretched or warmed up with an injury, and I think it's super important that we get involved early enough to prevent injury as opposed to just treating injury as surgeons. Do you see that?
Yeah, I agree. I think a lot of the literature now, in terms of, we talk about performance training first. It also is injury prevention as well, but working on really, as Mason talked about, being on the field, moving side to side, getting those lateral pivoting, cutting movements going before the speed jumps up in the game. So you want to start with more controlled movements as you're shifting back and forth. And we work with Darien High School in some of their warm-ups, and we're out there doing ladder drills, going side to side, sprinting 5 meters, going back 5 meters, looking at shuffling movements, and really start to engage that neuromuscular aspect of the warm-up before they have to exert themselves on the field.
And I think, as just a point to talk about, as a physical therapist, we see, and as orthopedic surgeons, we see that it's very important to have a sound stretching routine, warm-up routine, and not just when the season begins. This all comes into play well before any high school season or preseason begins. So I think a lot of times we see injured athletes. They come to us and they don't have any of these things in place that we've just discussed, really.
I think the nice thing too is I think the coaches are starting to adapt it a little bit more. So working with Lisa, she's been so open to starting that warm-up and stretching routine, because it only lasts about 20 minutes or so as part of your normal warm-up. Mm-hmm. And then you go back and you start your regular practice or your regular game.
Yes, yeah. And
so
this
have you
year,
noticed it's been
yeah,
seamless?
it's been, yeah, this year the main focus I feel like has been stretching and making sure that you have all those warm-ups in to prevent injuries, because last year on the team we actually had 4 ACL tears. So just from that, it kind of shook everyone up a little bit, and having HSS and physical therapy there with our team this year, it's really boosted everyone's energy levels, and it like makes everyone feel more confident knowing that there's a less percentage of getting hurt.
The other thing I liked what you touched about is really your presence as you walk out there on the field. I remember playing lacrosse myself, whether it was in high school or at Duke, and if another team walks out and you're all lined up in those 2 lines, you're ready, you're organized, your uniforms are perfect, it's an intimidation factor for the other team. So tell us a little bit more about that.
Yeah. Walking to the game, there's usually music playing, everyone has their hair all braided, eye black on. We always have to be in 2 lines, very organized going into the game. We're not allowed to talk. And then right as we walk into the field, everyone just puts their stuff down as fast as they can, and we just start off with the lap, and then we get into the whole warm-up I was talking about. Usually the music's playing, everyone's very excited, the atmosphere's good, good vibes, positive energy, and it just really sets your mind to be ready for the game that you're about to play.
So Brad, you were a tennis player growing up. Did you have a playlist? And I think my guess is our playlists were probably a little bit different growing up.
Probably a little different than the playlist now. Ice Ice Baby was really popular, and so that was one of the main hits. So probably not on the playlist these days.
Probably
but again, just like you said, it is important for a repetitive, same, work your way into with the playlist, with a structured entry, but just as important in that is the structured stretching and warm-up routine, which does allow you to play at your best with the least chance of injury.
And I think a big push now is, injury risk reduction programs. We say injury prevention, but there is no pure injury prevention program out there. Sometimes no matter what we do as athletes or surgeons or therapists, you can't avoid the sometimes inevitable injuries that we all see and that we see in the rehab world and the orthopedic surgery world as well. So, I think now we see a lot of programs that have come about. They're not all the same. They're very different and very varied. But there is a very large push now, and I think we see it in all of our offices and even in high school. We see that there's a very, very large and big push for injury risk reduction programs now.
No question. And I think in terms of looking at it from an injury standpoint or from wearing your joints out, proper mechanics, proper warm-up, proper stretching leads you to a more active and healthy but safe lifestyle. And many of my patients ask me, how can I prevent this, or how can I continue to use my joints in a fashion that doesn't necessarily lead me to a surgical intervention? And obviously all of these things are very important, but stretching, getting warmed up, and then symmetry in terms of the musculature. I think Dr. Sutton can easily tell you about leg dominance leading to one side being stronger than the other, or core dominance. And it's important to work on symmetry so that one side is not overpowering the other. And then especially in the female athlete, where there is a higher propensity for some sort of injury, especially including the ACL.
We'll be right back with more How You Move, coming to you from Chelsea Piers, Connecticut.
So one thing people are always surprised about when, as a surgeon, I want to prevent these injuries as best as I can. People are like, well, that's kind of interesting, and I would love if there were never an ACL tear ever again in an athlete. So I think a couple key points that Dr. Waddell was talking about is, as female athletes, we can do some analysis that Justin works with too, in terms of looking at how female athletes land, looking at how they move, and I think it's really important to find those key aspects of different angles of the joints and how they may be moving asymmetrically or improperly, and there are different ways we can correct it. Female athletes tend to have a really high quad dominance compared to their hamstrings, which puts them at a slightly increased risk for injury. And if we can really work on strengthening the glutes, the core, the hamstring, they tend to really get to survive their playing career a lot longer. I don't know if you have any other points with that.
Sure, and when we see patients in the physical therapy world and we assess them, a full body functional movement screen, athletes often think that they're very, very strong overall, very, very strong, but then we see them in the office, we see them in clinic, and they often have weaknesses that they never knew of. So it's very common to see high-level athletes that have very, very, very pronounced weakness that they never knew about that do put them at a higher propensity for injuries.
One thing I like talking to Mason about is your enthusiasm and how you embrace the weight room and training and strength and conditioning. I'm starting to see a turn. So when I was at Duke as a captain, one of my roles was really to encourage everybody to embrace the weight room. You're not going to end up like Arnold Schwarzenegger or some large bodybuilder. You're still going to maintain who you are. So do you think as a whole of your team, everybody tends to embrace that performance training?
Yeah. And like I said before, how kind of our focus has like shifted. Like we're now focusing a lot more on stretching and going to the weight room. It's just really positive energy in the weight room. And we do that now. We do the warm-ups with you at the beginning 2 times a week. I think it's 2 times a week, right? And then the weight room we do 3 times a week. But yeah, everyone looks forward to it. It's actually a really fun time being in the weight room with your whole team.
I think that's a key point. When I working out and working with the U.S. athletes in the lacrosse world, all of them were so excited to do their strength and conditioning, working with their performance coaches. And I think as orthopedic surgeons and as physical therapists, and certainly as athletes, if you can make those connections with some amazing performance coaches, it will change the way you are as an athlete. It'll make you faster, you can jump higher, you can really achieve more success by embracing that.
No, absolutely. It was a different mindset back when we played in college. So again, just going back, I think there's a hard push for injury risk reduction and overall strengthening. And another point that maybe we can discuss a little bit is about not being, focused on one sport too early as athletes, as high school athletes. We see often, discuss often that athletes like to specialize in sports. So maybe we can discuss a little bit about, is that the right way to look at it? Is that a popular way to look at it now, and what we really see?
No question. I think that there's been a lot of evidence, especially in the baseball world, with number of pitches and just focusing on one thing. It is better to be more rounded and allow yourself to sort of find what's best for you as you do more of these activities. It's number one, a team building exercise that's good for you in a social pattern, but number two, it's good for you just in terms of keeping healthy. And to Karen's point earlier, we have changed as orthopedic surgeons from sort of just operating to getting involved much earlier so that we can prevent surgery. Much like you, I tell all my patients, I want to do anything I can to not operate on you. And I think that's a really big change in orthopedics that we've seen over the last probably 10 or 20 years. And that is that instead of just you coming to us when you have an injury, us being involved much earlier so that we can prevent injury. And it is counterintuitive for a surgeon to say, I don't want to do surgery. However, we all know that if you can avoid surgery, it's going to be better for you in the long run. And while surgery is a life-changing, life-saving, a very good thing for a lot of patients, if you don't have to have surgery, you certainly don't want it.
Yeah, I think that it's key, and there's a really big presence now to not participate in one sport all 4 seasons. So just like Mason was talking about playing field hockey, I'd love to hear growing up, what were some of the sports that you liked to play growing up, whether it were just casual or recreational? Tell us a little bit about your childhood and your sports involvement.
When I was growing up, I played soccer, field hockey, I was on the swim team, I did gymnastics, I tried to kind of do everything I could. I did water polo in the summer, I think. Yeah, I did. And as you get older though, and you have to be more committed to one sport if you kind of want to go places with it. I know that I wanted to play lacrosse in college, so sadly I actually had to give up field hockey my sophomore year. if I wanted to continue going on with lacrosse. And so I gave up field hockey, and I just play lacrosse now year round. But I definitely think that if it was possible to play more than just one sport, I definitely would. I feel like that's definitely a good thing. When I was talking to my college coach, actually, he said we like to see players that are well-rounded with other sports, that don't just play one sport. But especially from Darien, like I said before, it's very competitive, very intense.
So I think that mix of the sports really builds you as an athlete and probably made you who you are right now and become such a powerhouse on the field. Mm-hmm. I think we can talk about complementary sports. So if somebody is playing lacrosse 3 seasons during the year and then they decide to play basketball or swimming, there are a lot of great traits of those other sports that you can incorporate into that sport. And I think people don't always get that, where you feel like you have to play repetitively. But again, as Mason said, usually by 15, if somebody wants to really specialize in that sport and does it appropriately, where you're in the weight room, doing performance training, doing cross training, then it is appropriate to potentially specialize when you're going to be playing in college.
So we're going to discuss a little bit further about common sports injuries that we see in high school athletes and athletes in general. And I think one hot topic nowadays is ACL injuries. And I know, Mason, you've had some experience with this, so if you don't mind discussing a little bit about what you've been through.
So about 3 months ago, I had surgery on my knee. I had an ACL repair with Dr. Sutton. It happened a little bit before my regular season started this year. So we were in Pennsylvania for an indoor tournament we do every single year. About half the team goes. The other team was my team was clearing the ball. The goalie was clearing the ball, and no one was on me. It was kind of stupid how it happened. And I kind of just leaped, and then once I landed, I pivoted. And right from there, I just fell to the ground. I couldn't walk on it anymore. It was actually like the most painful thing I've ever felt. I've never had an injury before, and this was my first time ever having like a major injury that it kind of just made me realize it can really happen to anyone. So you just have to be aware of how to try and prevent these things.
I think what we see when it comes to ACL injuries, that the vast majority of injuries are non-contact injuries. You know, most oftentimes people think and see in the media that someone rolls into your leg and your knee falls inward very awkwardly. But I think we see majority of the time that they're non-contact and at the least likely time when they occur.
Yeah, no one was on me at all. That's the kind of the most annoying part, that It was just a cut on my own, and I tore my whole ACL by doing just a little pivot. Yeah.
And is this something that you see often in your practice, Dr. Sutton?
Yes, so the ACL is a really important ligament of the knee. It's your anterior cruciate ligament. Anterior because it's at the front part of the knee, so there's a house where the ACL and the PCL sit. And so the ACL stands for anterior, and then the 2 ligaments cross in the front, cruciate, and ligament because it holds one bone to the other bone. It connects your shin bone or your tibia to your femur, which is your thigh bone, and it really helps protect the knee in pivoting, shifting, and cutting movements. We actually see up to between 2 to 8 times more ACL tears in female athletes compared to male athletes in those pivoting, cutting sports. And just as you mentioned, about 70% of ACL injuries in female athletes are non-contact injury, where you went and you were trying to do a quick dodge, or you were going out for that clear and shifting directions, and all of a sudden you feel a pop and swelling happens in the knee. And with those 2 symptoms, you can pretty much diagnose that there likely is an ACL tear. ACL injuries in female athletes happen more commonly, so we see them frequently in the office, unfortunately, due to some of those muscle imbalances. The quads tend to be a lot stronger than the hamstrings. There are different shapes of the house where the ACL lives. Some are a little bit more narrow in female athletes, so the notch of the knee tends to be more narrow. The notch is a little bit wider in our male athletes. And then, like we all see too, in some of these landing, pivoting, jumping movements that female athletes do, as a female athlete, we tend to absorb less force as we're jumping and landing, not flexing our hips, not bending our knees as much. And so that ground reaction force, or what we hit, is a lot more solid.
We're discussing high school athletes. Is there an age range that you typically see or that we see in the office as far as, the higher levels of or instances of ACL tears?
ACL tears certainly span the gamut. We see our pediatric patients have ACL injuries more and more frequently with all the sports that are being played. And then I'll see a 65-year-old gentleman who's playing a father-son soccer game, and he wants to get that ball just as anybody else does and may experience that pivoting, cutting, shifting movement of his knee and then have an ACL injury as well. So it happens throughout, especially our population. As we age, I think we're becoming more and more active. And I know, Dr. Waddell, you see a lot of that active aging population. And after I'm doing my ACL reconstructions, you may see them 20, 30 years later, and you can talk about what we see in that knee.
No question. So I think, as we've talked about, the whole kind of segment is that you should avoid us at all costs, except when we're teaching you how to avoid us. And so in terms of ACL injury, it can lead to down the line problems. Properly treating it, but most importantly avoiding it, are two ways to keep your joint healthy and happy. So as I talk to my patients all the time about, you want to be sure that you are having a symmetric joint, working your joint out, keeping the muscle strong so that, number one, you can avoid injury. But if you do have, say, an ACL injury, you want to have it properly treated with the most modern techniques and staying away from the cartilage, which can be damaged. You want to do everything you can to have that treated so that you can go about getting back to your sport and avoiding me for hopefully 20, 30, 40 years.
In our high school athletes that we see these ACL injuries happen, like Mason, is the approach often, is there rehab involved? Is it they jump to an ACL surgery right away? How do you really approach that with your potential patients?
I like to work with my patients in a multifactorial approach. I like to engage physical therapists, strength and conditioning coaches, athletic trainers. I like to engage the nurses. I like everybody to be on that same page with the patient. It's a massive team approach. Even in the operating room at HSS, we have a great team approach to our patients where the scrub techs, the nurses, everybody wants 100% for the patient, 110%. We want them to be out on that field. The last thing I want to do as a physician is to say, no, you can't play this or you can't do that. That's impossible for me to say. So we'll do anything in our power so that they can step back on that field and resume their sports.
I think a great point you make is that at HSS we try to have the most collaborative effort possible for our patients, whether it's with the coaches, the training staff at the high school, the doctors, the physical therapists, and of course, most importantly, the patient. So I think it's something that really sets us apart as a team at HSS, where we do have such a great collaborative work environment for our patients.
No question. I think us spending time together, while we may have different specialties, we can all learn something from each other's specialty. And Dr. Sutton's specialty and my specialty kind of tie in together because while our patients, some may be young or some may be a little more grown up, I like to say, we all can benefit from the different specialties and the expertise that each of us have to offer.
We'll be right back with more How You Move, coming to you from Chelsea Piers, Connecticut.
So Mason, since your ACL reconstruction, can you just elaborate for us on some of the steps that you've been taking in your rehab process?
Yeah, so I've been working with physical therapy, and actually right before my surgery, I was doing physical therapy to start strengthening my quad, getting it ready for the surgery. And then obviously right after my surgery, I could barely walk. I was on crutches for about 3 weeks, 2 weeks. So I started off with just movement in my knee, and my range of motion has gotten definitely a lot better. I can almost fully bend it now from when I first started. And then it's now going on to my 3rd month, and I will be running soon, which makes me very happy. I'd say it's a pretty quick recovery from other stories that I've heard. yeah, everything's been going really well with my physical therapy, my appointments with Dr. Sutton.
So it's always nice to hear that the recovery is going well and maybe better than you've heard someone go through. And I really do think that here at HSS, because we are so tight-knit and because we all communicate and we collaborate with our physical therapists, with the sports surgeons, with all the different team members, it does improve outcomes and gives us the ability to say that hopefully your experience here at HSS will be a little different.
I think one thing I try to do with my patients, including Mason, as well as your mom when she was in there too, is really setting those expectations. One thing I was so impressed by you is you were so realistic with your goals and achievements. You could actually see the long-term goals being set. Some of the challenges I have with some patients is I do the surgery and 4 weeks later they're like, am I running? Am I back on the field? What can I do? Can I pick up my stick? I'm like, wait, we talked about the whole plan. So I think you were a really, really strong patient, and you actually exhibited patience during this process, and I think that's made your recovery that much better as well, as you've put that time and effort in and taken it step by step in a process.
Yeah, and by you like setting those goals for me, like as a patient, it's really helped. It's kind of like boosted my energy, because I know going into it, when I first came to you, obviously I was like a mess. I was very sad about what was like the road to come for my knee, but it's actually not as bad as I thought it was going to be. Like, I've learned a lot from it, and the recovery's been going so well, so fast, a lot faster than I thought. So yeah, everything's just been great.
I tell my patients all the time, what can really make your road a lot easier is me to sit down and tell you exactly what to expect, because almost every one of my patients, whatever surgery it is I perform on them, they don't know many people who have had that surgery, and they have not had that surgery themselves. And so while it does take quite some time to really explain to each patient, and maybe 4 or 7 or 10 times a day, say sort of the same things over and over again, setting the expectations and giving the patient the most amount of information that they can take about what they're about to go through does make their life a whole lot easier. I think that's something that my patients have come to expect from me, is that I'm going to sit and spend a ton of time with them to fully explain what is to come. And they know when I'm 20 minutes or 30 minutes late for the next appointment, they're going to get the same respect and the same amount of information, which makes it okay for them to wait a few minutes.
I think too, being out there in the community, working with the coaches, working with the athletic trainers, you get everybody on the same page. I will never shy away from putting my sneakers on, grabbing a lacrosse stick, and trying to get out to the field, because it is nice to meet the coaches. And if one of their players is injured, it's nice to have the trust of the coaches, the families, the athletic trainers, that I will do everything I can to get that athlete back on the field and be able to explain it to them, and so they do understand the process to go through.
I think a good point is that when we talk about expectations, we're not only discussing expectations with patients or the patient's family, but we sometimes have to realign the expectations of the coaches, of the trainers, of the college coaches, which you're having some experience with right now. So there's a lot of people to kind of rope into the mix of setting expectations and realistic goals for return to sport for our athletes that we see.
In our segment of How You Move, it's been thrilling to talk to physical therapy, an amazing athlete, as well as have surgical involvement in the discussion, and really talk about how HSS is really involved in the community to prevent injuries, to educate patients, to really make everyone feel comfortable coming into their backyard at HSS in Stamford and knowing that we're here for all aspects of your athletic career.
I'd like to thank Dr. Sutton, Dr. Waddell, and most importantly, Mason for joining us on our first episode of How You Move. Please join us again next time.